And one thing I would mention that I think will be really useful next week when it launches is the Unity Project also put together a survey a couple weeks ago and sent it out to community service and program providers across the city to figure out what services are still available, how LGBTQ communities can still access those services, like whether they're virtual or still in person. And we got 300 responses from different service providers and program folks, which is why it's taken us a minute to put it all together. But next week, we're going to be launching it. It's a great website. It has over 100 resources, both local and national, for LGBTQ folks to access, including city services. And I think, often we maybe know about community health organizations or community-based and run services and programs, but the broader community doesn't always know about some of the LGBTQ affirming city programs and services we have, like our public health hospital system that has pride centers across the city, for example. So that website is going to be really useful and helpful, I hope, for lots of folks, just to have a centralized place where people can get information about healthcare access, housing resources, employment resources, mental health services, and there's a whole list of other things that are up there. So I'm happy to share that with you all. It'll be up on nyc.gov/Unity Project next week. So please look out for it, and we're going to be sending it out all over the place. So I hope it'll be useful.
Thank you for sharing. I think it'll be very useful because I think folks are really looking left and right for resources for the trans and queer community at this time.
Yeah.
So,
and Farhat, can you share that with us when they share it, when Ash shares it with you? I would like to share that.
I'll distribute it to all of my contacts.
Awesome.
And then, Jia, how have you seen, maybe even outside of organizational support, like how have you seen maybe just your own community show up at this time of crisis? And like, are there any gaps you're seeing that could be addressed by the larger, maybe more privileged trans and non-binary communities in New York City?
Yes, thank you.
Yeah, I've just been seeing a lot on the internet, so I just thought I'd put this question out there.
Yeah, I want to say I am in awe of the love and the effort that I've seen happening in mutual aid groups, particularly in New York City. People volunteering to help the queer community. And that's something that we've been doing before the coronavirus pandemic. I would say in my personal experience, like I would not have survived as long as I have without the support of the LGBTQ community, particularly mutual aid efforts.
Mm-hmm.
I think there's a need for frontline workers to have hazard pay and an increased wage above minimum wage, maybe even like $20 or $25 an hour, because a lot of those people who hold those positions are Black and brown people, are queer Black and brown people.
And they all somehow happen to be from my neighborhood, the Bronx. So
I'm from the Bronx. Woo! Yes. We definitely need people power. Trans people need their hormones delivered in the mail. They need mental health care, and we need medical care. In New York City, we have Cal and Lord, which is the LGBTQ health center, for those who don't know, and they're very overwhelmed at this point. We need COVID-19 tests. We need a systemic overhaul of government. We need universal basic income. We need universal health care. We need free housing for all. Cancel rent forever. And those are the gaps that I'm seeing. So yeah.
Thank you for sharing. I mean, there's just so much we can hope for, especially I'm thinking, what will our society, how will we look like even as human beings after this pandemic is over, and what systems can we recreate that weren't working even prior to the pandemic. So I think those are really important questions that we're all grappling with. And I think that brings me to my last question. It's a wildcard question. I didn't share it with you prior, but what is a message of hope you want to give to trans, non-binary, and intersex communities, particularly youth and teenagers who are at home social distancing? So, Pooya, do you want to go first?
I'll put on my Mama Pooya hat. This has taken up a better part of my time over the last 5 weeks because, you know, I mean, I always call myself a community mother, but then I also always ask, what does that mean? That I share the history of our community, what part of it I know and what part of it I've been a part of and what part of it I've heard. The fact that, like I said earlier, that, you know, our community has gone through ups and downs. We've been pushed in this corner, then we've come out of this corner, we've been pushed in that other corner. The fact that even during this pandemic times, we realize that there are certain conservative states that even within this pandemic, they are pushing their anti-LGBTQ agendas forward. And like that part of it just boggles my mind. So I'm not going to just close my eye to that because that is a very real thing. And I know that younger members of our community, they see those things because those are headlines. So we're not going to pretend that, oh, they're not seeing that. And it scares them. I hear it. They tell me, they're like, well, what is going to happen to the world? But what I tell them is how I always bring my story. I was a trans child 20-something years ago in a Muslim country that had never uttered the word trans. That was hard. That was isolated. I don't wish it on anybody, but here I am because there were people who extended their hand. There were angels in the form of human beings that came to my help. And the human resilience. When you're younger, your experience is the 15 years, 17 years that you've seen, and you feel that things that are going to happen is going to be the end of your life. You feel that if you don't get your surgery next week, that your life is over. But as someone who had to wait 5 years until I could get my surgery, that I had to wait years before I could start my hormone therapy and all of those things, I can sit here and say, you will survive this, you will learn from this, and you will come out wiser, stronger, and more compassionate. Because when you're in difficult situations, you become more aware of other people's difficulties. And so what I want to say to all the kids out there, hold on tight, know that you have the strength to go through this. And while the things you're waiting for, whether it happens to be your surgery, whether it happens to be wanting to physically commune with your community friends and your community family again, know that there is going to be a day after all of this that we're going to get out there and we're going to get up and we're going to rebuild a better society, all of us together. And everything that we take from this opportunity will come in handy in the upheavals that we'll face at different stages of our life. And that we're all in this together in different capacities. But we have what it takes to move through this with flying colors, collectively.
Jia, do you want to maybe provide a message of hope to our young teens and tweens out there?
Sure. My message of hope is that a revolution is coming. Because of this pandemic, we cannot go back to normal. This is the new normal. And we all have a role in shaping the future that we want to see. Trans people are revolutionary and will be at the forefront. Black and brown folks will be at the forefront and are revolutionary. And we have the power to be the change that we want to see in the world. And that's my message of hope.
Thank you. Ashe,
I
your
don't want to follow those two.
yeah,
I have nothing
I
useful
give
to
you
say beyond those things.
yeah, it's a hard comeback for you, but
Yeah, I mean, I think both messages resonate really deeply for me. And what would I say? I mean, just know that there are communities of people who love you and care for you and love you for exactly who you are, in exactly every iteration of who you are, right? And I think that's always been helpful for me to turn to, knowing that there are elders and ancestors who have held me and the possibility of my existence into reality today. And there will be trans and non-binary and gender non-conforming folks in the future whose possibilities we're creating today. So yeah, just know that you're held and loved by both your ancestors and us and the future iterations of all of us.
You're making me cry.
well,
Yeah.
I want to end our panel. You've all spoken so eloquently and on the different issues facing our trans, gender expansive, and intersex communities throughout New York City and beyond. You all are also possibility models, and thank you for sharing space today with me.
Thank you for
Thank you for
creating space.
giving us the space.
Thank you.